The real issue here is the contralateral disease. The risk of stroke, the risk is associated with contralateral disease progression, and that's what's been found in all the studies. So if you look at it, the chances of progression and linkage with the association between the two has been documented, and specifically when the lesions increase to greater than 70% diameter narrowing. So if you look at a case here, a preoperative evaluation with Doppler ultrasound, there's a stenosis on the left, 210 centimeters per second. The patient is symptomatic. On the right, the velocities are 362 centimeters per second. So we take the patient, there's an intervention. The preoperative velocity is 362. At 1 month, it goes to 122 centimeters per second, and then at 6 months, 91 centimeters per second. I just mentioned the fact that sometimes early after endarterectomy, the velocities can be slightly elevated. If you look within the first few months, they can be slightly elevated. And in the literature, there is an indication in the primary closures, the velocities can stay elevated for up to 1 year after the actual procedure. But the patient is interested because we're going to look at the left side, the non-operated side. So preoperative, 210. The velocities drop down to 197 centimeters, likely related to the fact that we eliminated the contralateral stenosis. Because of the presence of high-grade stenosis on this side, the velocities can be artificially elevated on the contralateral side. You take away this lesion, the velocities go down a little bit. And that's what happened, minimal, within the range of measurement error in this case. But 6 months after, velocities are back up, patient is becoming symptomatic. So this is the reason, at least one of the major reasons currently for doing surveillance.